Good afternoon, everyone. Thank you for joining today's webinar on the Hep B United mini grants, developing innovative practices for hepatitis B education and screening. My name is Catherine Freeland, and I'm the Public Health Program Manager at the Hepatitis B Foundation. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that attendees are in listen-only mode and will be muted during the presentations. There's a phone-in option, and the call-in numbers are listed on this slide. You may submit questions in writing during the presentation by typing them in the question box on your GoToWebinar control panel. We will be reviewing them as they come in, and we'll hold a question and answer period after the presentations. I would also like to draw your attention to the handout section. You will find a PDF of the RFP for the mini grants available on your control panel. Finally, today's webinar is being recorded. You will receive an email with a link to view a recording of today's presentation after the Hangout. I apologize for the technical difficulties, everyone. We're working on getting that fixed. But in the meantime, I'll go ahead and give you an overview of Hep B United. Hep B United is excited to present today's discussion of mini grants. These ongoing mini grants are excellent opportunities for coalition partners to build capacity and strengthen outcomes. Our speakers today will discuss their experience as Hep B United mini grant recipients from the past year from Georgia and Philadelphia. Hep B United is a national coalition co-chaired by the Hepatitis B Foundation and APCHO, comprised of over 35 organizations across 18 states with a mission dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities. I apologize, my PowerPoint froze. So just to give you guys an overview of the RFPs, which are included in your PDF, Hepatitis B Foundation is offering mini grants for 1 year for Hep B United partners working on hepatitis B screening, education, and linkage to care. Up to 7 awards will be given, ranging from $5,000 to $10,000. The eligibility criteria for those participants: applicants should be able to demonstrate that they have a place in an active local coalition focusing on hepatitis B education, screening, and linkage to care activities. Eligible participants must be current Hep B United members with the capacity to directly implement the proposal, collect data as required, provide written reports, and manage the funds appropriately. And applicants must also submit a project proposal, and the RFP outlines in detail the project proposal and the requirements to be within the proposal. The purpose of these mini grants are to enhance the capacity of Hep B United coalition partners to conduct hepatitis B education, screening, linkage to care in their local communities with a focus on Asian American, Native Hawaiian, and Pacific Islander communities, and supporting activities at the local coalition level to advance hepatitis B priority areas laid out within the Department of Health and Human Services National Viral Hepatitis Action Plan. The focuses are 1, prevention and education, 2, linkage to care, and 3, surveillance. In the past, mini grant projects have focused on education and screening programs, perinatal education for providers, which you'll hear a little bit more about in the coming slides, HEAL education program, which is designed for high school students and medical students. It's a train-the-trainer model where medical students go into high schools and provide education for children in high schools. Also, one former clinic created an EMR at a federally qualified health center. And some of these images here are some ideas of images of past events that have happened. Since 2015, we have distributed a total of 16 mini grants, which has helped supported 150 events, educated 13,000, screened over 7,000. We found infection rates of hepatitis B surface antigen between 2.7 and 10%. Through the mini grants, we've also vaccinated 400 individuals and linked care between 83 to 97% of individuals. There's also been a significant media reach through the Hep B United mini grants, and we've served a variety of populations, and those demographics can be seen within this table. So if you're interested in applying, the application deadline is August 20th. If you have questions, feel free to email me at the email address listed here, and I'd be happy to help you brainstorm or give you a better idea of whether or not you think your application would be a strong candidate for the mini grants. So I would like to introduce our two speakers today. Our first speaker is Mindy Lee, and she's the Health Program Specialist at the Center for Pan-Asian Community Services in Atlanta, Georgia. And she will be followed by Deborah Hines, the Perinatal Hepatitis B Prevention Program Epidemiologist at the Philadelphia Department of Public Health. So with that, I would like to turn it over to Mindy Lee as she gives her presentation.
Thanks, Catherine. Good afternoon, everyone. My name is Mindy Lee, and like Catherine said, I'm the Health Program Specialist at the Center for Pan-Asian Community Services, or CPACS, in Atlanta, Georgia. And today I'll be talking to you a little bit about our Hepatitis B program, which aims to provide education, outreach, and free screenings, as well as linkage to care in our community. And we're able to do this work with the help of the mini grant funding from Hep B United. Next slide. So we'll start with a short overview of CPACS and what we do, and then we'll go into what our Hepatitis B program does, what it's accomplished, and then wrap up with some of the challenges we've encountered and lessons learned. So CPACS is a nonprofit organization that started in 1980, and we provide a wide range of social services to primarily limited English proficiency communities. So we see a lot of refugees, immigrants, and ethnic minorities. And because we see such a diverse community, we focus on providing services in 7 main languages, but collectively our staff members speak over 16 languages in-house. So we're able to provide a lot of our services in language through interpreters and through translating a lot of our own materials into languages that our community speaks or reads. We have 3 offices in Atlanta, in the Atlanta area, as well as a federally qualified health center just 4 miles down the street from our main office. Next slide. And CPACS is really dedicated to providing people with support and resources necessary to be self-sufficient and empowered. So we do have 12 different departments that provide a comprehensive set of services. So we have immigration and legal services, senior services, youth services. And one of those departments is the Community Health Department, which I currently lead. And one of my favorite programs in our health department is our Hepatitis B program, because Hep B affects such a large majority of our population, but so few people know about it. Next slide. With the support from Hep B United and a local foundation, as well as our local coalition, we are able to implement the Hep B program to raise awareness, screening, and hopefully vaccination and treatment for Hep B among Asian immigrants, African immigrants, and all ethnic minorities. We do this work through offering free screenings and formal education sessions. We currently do this for our senior groups that we run out of CPACS, and we've also done lunch and learns with our staff members previously. And to be able to do this work, we inherently do a great deal of coalition or partnership building within our local community, as well as advocacy. Through this mini grant, I was given the opportunity just a couple of weeks ago to attend the Advocacy Day with Hep B United to talk to some of our Congress members about increasing funding and support for Hep B. So that's my little plug for myself, our picture there. Next slide. So as far as community screenings, we've held 5 screenings so far this year, and we have 3 more scheduled for the fall. Our community screening events are always done in partnership with a local organization that's part of our coalition that is already holding a health fair or some sort of gathering or meeting. We've learned that this is the best possible way to get the most number of people screened. So we offer up CPACS events for people to do programs that they have. So if they have a HIV program or diabetes education, we offer up space in our events for them to do that. And when they're holding events, they invite us to do the Hep B portion since our program is already established. During these events, we talk to people about Hep B, what it is, what their risks are, and if there are staff members who can share personal stories about Hep B in their family or in their personal lives, we also do that. And we also provide in language fact sheets that they can take home with them. And after they sign the consent form and we go through all of that process, we have the nurses draw their blood. The nurses are also part of a organization that's part of our Hep B coalition here. So they volunteer their time to help us. After they do the blood draw, we inform participants of their results within a week by phone. And if they're not available by phone, we send it out by mail. And we have interpreters do that because we serve a large population of people who don't speak English as their primary language. And if they are susceptible or have an infection, acute or chronic, we make sure we link them to care. So we have an FQHC, like we mentioned, so we either refer them there if it's something we can manage there or to a specialist, and we have relationships with specialty clinics in the Atlanta area. Next slide. For our education workshops, we work with a organization called Prime Education, which is a continuing medical education organization. They've offered to provide us with PowerPoint slide and fact sheets that we can use to host these education sessions. And we actually hosted a first one yesterday, which reached 31 Burmese seniors in our senior program. We have 3 more planned for the next 2 months, which will be presented in language in Chinese, Korean, and Nepali. And these sessions consist of a pre and post test to measure change in Hep B knowledge. And we also give participants in language fact sheets as well as a small incentive such as bags or pens or notepads and sometimes gift cards to encourage them to pay attention. This particular activity was actually really exciting to put together because originally when we were asked to or when we were planning to do it, we tried to recruit from the community at our screening events for people to come to our education sessions, but then we realized we had all of these seniors in our existing senior program who come to our office every week. And they're actually right in the age range of those who are least likely to have been vaccinated against Hep B. So realizing these two things and being able to bring that together was really exciting because we had this huge group we were overlooking right in our building. So that's kind of a lesson learned in that respect. And next so more looking inwards, we had this realization with our staff as well. Somehow, we were pushing all of this Hep B work, and most of our staff members had never been tested or didn't really know about Hep B themselves. They knew that we were doing important work in the community, trying to get people tested, but didn't really realize themselves how important it is. And we are made up of a large API community within our building. So we held a lunch and learn to kind of go over details of Hep B, and then everybody got screened afterwards. So this is a picture of them very proudly showing where they had their blood drawn. Next slide. And in order to do all the client-facing Hep B work we do, we really do depend on our partners and the resources they provide us in the form of access. Primarily, we currently partner with 4 different culturally specific organizations, and they really serve as champions for our work, which gains us so much more credibility and access than we would have otherwise. And of course, there's LabCorp, who provides us discounted lab fees and supplies and have been very flexible to the nature of our work. So even though they're not like formally part of our coalition, we do work with them and they're very flexible with us. So I think it's important to acknowledge that. Next slide. So outcomes, we've screened, we've screened 229 people in the year that we've had this funding, so fall of last year till now. And we actually screened 50 people on Saturday, so we don't have those results just yet. But out of the 179 that we had screened prior to Saturday, you can see that 44% of them were susceptible, so they never had the vaccine. Most of them didn't even know what hepatitis B was, so it's really great that we got access to them and are able to link them to care to get vaccinated. About 6 people had an acute or chronic infection, so they were linked to treatment. And of course, we refer 100% of people who are susceptible or have an infection to care to either get vaccinated or get the treatment that they needed. And then we've, like I said, educated 31 community members through our education sessions that we just started holding this week. Next slide. And our lessons learned, just to kind of round us out, you can't do it alone, which is why I think the coalition requirement is a very important part of this mini grant. Is you really do need partners in your community to help you do the work that you do and reach the people that you want to reach. But you also need them way before you start doing the screenings and education, because when you say AAPI or Asian American communities, you're talking about a wide range of cultures, languages, and communities, and you really need the experts in each of those communities you plan to work with to let you know if your goals are going to be feasible. For example, yesterday we had our first education session with the Burmese population, and I thought we did everything we could. We got the pre and post test translated into Burmese. I had interpreters available, but the pre-test took 45 minutes to do because we realized that a lot of people in our population couldn't read, even though the material was in language. So that kind of brings me to my next point, which is when you're working with AA AAPI communities, don't not only consider language, like providing in language materials is great, but also consider literacy levels, because even if you provide in language materials, they might not be able to read it. Don't be afraid to ask for what you need. When I was at the Hep B Summit a couple weeks ago, somebody from I think it was Sierra, provided a really great presentation. It was a really condensed version of what hepatitis B is, some of the myths and misconceptions, and I thought it was a really wonderful presentation. And I asked if she had it in language, in any other languages, and she said she didn't, but I could ask someone, Cynthia Jorgensen from the CDC, if they could create something like that. And that's something I would have never thought to do on my own. Walk up to someone and just like ask for presentation on Hep B in the language that I need. But that's exactly what you have to do to get the materials you need for your community, and they were really happy to accommodate. The other thing that I've learned is hepatitis B doesn't exist in a vacuum. For most people in our community, hepatitis B is around because they weren't vaccinated for it, and it's not something we talk about. But for a lot of people, it could indicate other health issues such as hepatitis C, HIV, especially if it's a sexually transmitted um, occurrence. So either way, it's important to remember that if someone tests positive for hepatitis B, it's going to open the door to medical care that they might have never had, or to issues that they might have to look into. And finally, caring for your community is an ongoing process. I recently graduated with my MPH, so I'm a big stickler for methodology, and I want to do everything by the book. So one of the biggest lessons I've learned is that it's an ongoing process implementing this program, because the community is always changing, and you can always do your best, but be open to the fact that it might change and you will have to adapt. And it might feel like you're doing something wrong because it doesn't apply by the methods that you learned, but you're actually doing it better by creating something that can actually be useful to the community that you care about. And next slide. And that's it for me. I am happy to take questions. I think we might be doing that at the end, but this is my information if you want to reach out to me and have any questions. Thank you so much.
Great. Thank you so much, Mindy. And yes, you are correct. We will be taking questions at the end. And just a reminder, if you have questions for Mindy now, go ahead and submit them in the question box or the chat box, and we'll be taking those at the end. So now I'd like to turn it over to Deborah Hines with the Philadelphia Department of Public Health. Deb?
Hi, good afternoon to everyone. Again, my name is Deborah Hines, and I am the Perinatal Hepatitis B Prevention Program epidemiologist for the Philadelphia Department of Public Health. And first, I want to thank Mindy for that presentation because I thought that was great, and I actually learned quite a bit from it, so thank you, Mindy. And I will be talking about our portion for the mini grant, what we did with it, with the funds that we were awarded. We were able to provide perinatal hepatitis B prevention training for both prenatal and pediatric providers. And it was a great experience. Next slide, sorry, Catherine. I was actually trying to do it myself. So I'll first start off with a brief overview of perinatal hepatitis B transmission. Most of you probably are familiar with this, so I'll just go over it briefly. So perinatal transmission, also known as vertical transmission, is defined as the transmission of hepatitis B from mother to child before or after birth. And in numbers, the risk of perinatal transmission, of hepatitis B is 40%. There is a 40% risk of vertical transmission without the proper post-exposure prophylaxis, which consists of hepatitis B immunoglobulin, also known as HBig, and also the birth dose of Hep B vaccine. So if these aren't administered within 12 hours of birth for infants born to Hep B positive women, then there is a 40%, almost 50% risk of vertical transmission. And those infants who are perinatally infected, they have a 90% risk of becoming chronically infected. And 15 to 40% of those who are chronically infected will go on to develop liver cirrhosis and hepatocellular carcinoma. In Philadelphia, perinatal, there are on average 170 births to Hep B positive women each year. And for 2016, 74% of the mother-infant pairs in Philadelphia were born in a Hep B endemic country. So that's close to 3/4 of our mother-infant pairs, they were born in a Hep B endemic country, which is an important risk factor for hepatitis B infection. And almost half of those were born in Asia. Next slide, please. So I'll go over briefly the standard care for both women who are Hep B positive and the infants born to women who are Hep B positive. Briefly, all women who are pregnant are supposed to be tested for surface antigen. And then those women who test positive for surface antigen, it's recommended that they receive additional testing in the form of hepatitis B envelope antigen, also known as Hep B antigen, and also it's recommended that they receive hepatitis B DNA. But these are two recent recommendations that were made by the Advisory Council on Immunization Practices, and the MMWR was released for that in January of this year. So those were two new recommendations. And it's also important that women who are pregnant and are Hep B positive, well, all Hep B positive people in general, should be referred to and evaluated by a Hep B specialist, which includes a gastroenterologist, hepatologist, or an infectious disease specialist. For infants born to Hep B positive women, it is important that they receive vaccination at birth. They get the PEP, which I talked about in the previous slide, which consists of the HBig and Hep B vaccine within 12 hours of birth. And they also go on to receive 2 additional doses of the single antigen Hep B vaccine at 1 and 6 months of age. The schedule slightly differs for infants who get the combo vaccine, commonly known as Pediatric, but they typically receive 2 additional doses of the Hep B vaccine. And also they are to be tested. It should be performed at 9 months of age. That's the recommendation, between 9 and 12 months of age, more commonly at 9 months of age. So they receive 2 tests, and the only 2 acceptable tests is the hepatitis B surface antigen, and then to test for possible infection, and also the antibody to the hepatitis B surface antigen, which tests for immunity to see if they develop immunity as a result of the vaccination. Next slide, please. So for our project, for the mini grant, our primary goal was to educate in order to educate both prenatal and pediatric providers in order to create a sustainable change in their practice and the care that they provide to women, pregnant women who are Hep B positive, and to the infants born to these women. And we did this by creating education modules specific for both. So it was 2 education models created for both prenatal and pediatric providers. And we provided on-site education. The goal was 20 prenatal providers and 24 pediatric providers. And all of this is to improve the numbers, so improve the proportion of women who are tested for hepatitis B DNA, women who are surface antigen positive. We want to improve the proportion of those who are tested for also DNA and also e antigen, and also to improve the proportion of Hep B positive women who are referred to a specialist for care, and also improving the numbers of infants who are referred to a specialist if they are perinatally exposed, and also to increase the proportion of infants who are tested for PBST within 1 year. And we also wanted to make sure that we provided education brochures, which we have developed to these providers, to these different practices, so that they can have something to refer to. Next slide, please. So I'm just going to briefly go over how the actual education sessions went. And both the prenatal and pediatric sessions pretty much went the same. It was just different content for the most part. The background information was the same, but the care was different. So for the prenatal provider education session, it was about a 30-minute presentation, and it contained about 15 slides of content. And that content included a brief review of hepatitis B, including the risk factors, also the numbers that I shared with you earlier, which included the epidemiology of Hep B transmission and perinatal Hep B transmission. And we also went into detail about the standard prenatal care of Hep B positive women. And most importantly, we included a portion that, and it was mostly, I said a few things. I was the one who carried out these education sessions, but this portion was an open discussion for the providers to discuss specifically perinatal Hep B and Hep B in general, and the Asian American and Native Hawaiian Pacific Islander population. So it kind of encouraged them to discuss their standard of care, their practice when providing care for this particular population. I discussed the prevalence of Hep B in this population, and also encouraged them to be cognizant of the varying cultural beliefs and their roles in the healthcare perception. So this was a great opportunity for me to learn about how the different providers provided effective care to these particular populations, and keeping in mind the varying cultural beliefs. And I was able to, what I learned from each session, I was able to bring to the subsequent sessions. So we spent quite a bit of time on that, and I learned a bit, and I think it helped the providers to think more about this, even for those, most of our providers do care for a large percentage of this population, so they are experts in it as well. And also, I administered a pre and post assessment and there were 3 questions for both each. The second question was 3 parts, and it pretty much addressed the broad topics for prenatal care for women who are Hep B positive and pregnant. And it contained all the questions for pre and post were similar, and then there was a space for feedback included. And you can't really see it in this format now, but I can read some of the questions. The first question was, what percentage of infants perinatally infected to hepatitis B will become chronically infected? And this question kind of highlights the importance of the urgency of preventing Hep B for infants, and to test to see if they were aware of this importance and the urgency. And the second question was about testing. When should a pregnant woman be tested for hepatitis B surface antigen? And also it asked about the additional labs that should be ordered if the woman was positive for surface antigen. And then the last question was concerned regarding treatment. When should a woman who is Hep B positive be treated for during pregnancy, treated for her Hep B care? And we also provided light refreshments for each education session. Next slide, Catherine. So this is just from thus far to date, we have provided educational training for 48 prenatal providers from 6 different facilities. All providers, they serve a large percentage of Philadelphia's Hep B population, and for the Asian American, Native Hawaiian, Pacific Islander population as well. Trainings began in January 2018 for both prenatal and pediatric. And we have some preliminary findings from the sessions that we provided thus far. And this graph displays data from the pre-assessment of the 48 prenatal providers that were in the training. We were able to get 27 of them to complete the pre-assessment. And for some of these trainings, there were providers who called in, so they weren't physically there and they weren't able to actually complete a pre or post assessment. But what's interesting from this, as you see, that there's not 100% for any of these topics. Like, they weren't 100% sure. It highlights the gaps in knowledge. And they scored best on question 2A, which was when a pregnant woman should be tested for hepatitis B surface antigen. And I'm not quite sure, but I think this is the case because it's a universal policy. So there's universal screening of all pregnant women for Hep B. So I think that's why this is something that they were more familiar with, more knowledgeable with. But when it came to the additional testing and for treatment, that's when the knowledge seemed to taper off. You could really see the gaps. And there currently isn't any universal policy regarding this. So maybe there is an association, a correlation between the provider's knowledge and if something is like a universal policy. So I thought this was interesting from what we gathered thus far. From this, you can see that there are gaps in peri-Hep B knowledge for prenatal providers. Next slide, please. And this is so this is the pre-assessment and for the pediatric education session. And it was, as I said earlier, it was very similar to the prenatal in format, and it was about 30 minutes as well and had 15 slides of content. Everything else was pretty similar with the exception of the care. We were discussing care of infants born to Hep B positive women and not care of the actual mothers. And again, there were pre and post assessments administered during the training, and there were 3 questions, and the second question was 3 parts. And again, the first question was regarding the percentage of infants who could become infected if they didn't receive post-exposure prophylaxis. And the second question was about vaccines, the dose and the schedule of vaccines for infants born to Hep B positive women. And the final question was regarding testing, the post-vaccination serologic testing, and the 2 tests that it comprised. And again, light refreshments were provided for these trainings as well. Next slide, please. And this is just also some preliminary outcomes, preliminary findings from what the trainings we've done thus far. We've trained 25 pediatric providers, and again, all providers served a large percentage of the Philadelphia Hep B population. And we've had, of the 25 providers, we've had 28. I know the number doesn't really match up, and that's because for one of the provider education sessions, we had a group that had a variety of specialists. So we had pediatricians, OBGYNs, family medicine, and a few other behavioral health. So a few providers that weren't pediatricians, but they did serve a large Asian American population. They did complete this assessment as well. So that's the discrepancy in the numbers. And again, you see here, there you can see with the very low percentages of correct responses. There again it highlights the gaps in knowledge for care of infants born to Hep B positive women in all for all categories, for vaccine and for testing. There were gaps in knowledge. Next slide, please. So successes, thus far, there have been a total of 77 providers trained. There are more trainings that are scheduled. We have one upcoming prenatal provider training next week, actually, and then we have a pediatric provider for a major Philadelphia hospital. And at first, it was supposed to be like a smaller session, but then we were invited to do the grand round that's open to all pediatricians, including residents and attending. And there are also 2 pending pediatric trainings that I'm waiting for to confirm dates for it. Overall, the trainings have been well received. I've received positive feedback. I really haven't received any negative feedback, and the providers seem very appreciative of the information. And I was even invited to give a prenatal training session. For most of these, I've had to reach out to the facilities and work with someone to schedule me in to maybe monthly. For all of these trainings, I've been included in an actual monthly or quarterly meeting of the providers. But I was actually called and invited to give a prenatal training session for a session I did last week. So it's being well received. Next slide, please. Lessons learned, as you saw from the graphs that I showed, that there are gaps in perinatal Hep B knowledge among both prenatal and pediatric providers, and continuous education is needed. If it's in the form of on-site education sessions or even providing fact sheets. So we have fact sheets for both prenatal and pediatric providers that contains the pertinent information, such as testing for mothers and testing and vaccination for infants. So it is needed because there are gaps, and it's understandable because providers have a myriad of illnesses and diseases that they have to keep up to date on. So if they aren't serving a large population that have Hep B or infected with Hep B, they may lack in their Hep B knowledge. So continuous education opportunities are needed. And I've also learned that there is an interest among providers for perinatal Hep B training. All of the providers during these sessions were attentive, and they had questions, and the sessions were interactive, so they were really into it. There's an interest there. And also, I think this is very important, providing food is helpful in creating a positive and interactive learning environment, especially when it's a morning session. And I've done a lot of early morning sessions, and they're appreciative of the food and the coffee. I think coffee is very important as well. So you want your audience to be happy. All right, that's very important. Next slide. Moving forward, I think more provider education is needed. We still have many other pediatric practices and prenatal practices that we can reach out to. And we also can include Hep B specialists, so gastroenterologists and hepatologists and infectious disease. We can extend this training opportunity to them. And also, we do need to assess the effects of the trainings on the project objectives. We have the pre and post assessments, which is great, but we need to see if this really had an effect on testing of the providers that we educated. Did they change their testing practices for Hep B positive women, pregnant women? And did they change their practices in referring Hep B positive women to specialists? And also for testing for infants, do we see the proper tests being ordered for PBST, the post-vaccination serologic testing? And are infants being referred, infants who do become perinatally affected, are they being referred to a specialist? So we need to assess these and see if there was a positive effect from these trainings. Last slide, next slide, please. And I would just like to thank Hep B United and Hep B Foundation for this opportunity and the support to provide these trainings. And also my colleagues, Danica Concio and Jack Hildick-Smith of the Philadelphia Department for their support. Next slide. And this is my contact information here, including my office. And I didn't include my email, but if anyone wants it, I can offer it to them. And that's it. Thank you very much for listening.
Great. Thanks so much, Deb and Mindy. So again, the RFP is in your handouts, and it's due, the proposals are due August 20th by 5 p.m. Pacific Standard Time. If you have any questions about the RFP or the mini grants, you can always email me at this email here. So with that, I would like to begin the question and answer portion of our webinar. As mentioned at the beginning of the call, we'll start by answering questions submitted to us in the chat box. If you would like to submit a question now, please do so by using the questions field on your control panel. Our first question is directed at both Deb and Mindy. We had a question come in that's asked about funding and other funding sources besides the mini grants. And are either of you using outside funding sources for each of your projects?
Hi, this is Deborah from Philadelphia.
No, go ahead.
Okay. We just strictly use the money from the mini grant to carry out this for the food and for the brochures. We didn't use any additional funding.
Great.
This is Mindy with CPACs. We do have additional funding from a Georgia-based foundation here.
Great. Thank you, guys. This question is for Deborah. Are there any plans to assess if testing is happening for these providers that you're educating?
Yes, so that's after we've completed all of the training sessions, I guess it's in September, we'll be able to look at any we'll look at some of our mother-infant pairs who are receiving or received care from these facilities and compare to our baseline to see if there were any improvements, because we keep track of any providers who may, like, say for a pediatrician, if they order incorrect testing, we keep track. We're able to keep track of that. So we'll be able to see if there was any change, and that is in the works.
Great. I also have a couple of questions for Deb. Are you willing to mentor other potential coalition partners who are interested in doing a similar project?
Sure, no problem. I would love to.
Awesome. The other question, for those of us who are not well connected with our city or local health departments, do you have any advice for how we can get connected with them and get involved?
I say just reach out. I don't know if you can go to the local health department's website and then go to the specific program or department and find a person who is the lead, whoever they have, whatever contact person they have, and just reach out to them. And I learned the importance of reaching out to others because I had to schedule these provider education sessions. And I could reach out to someone who I'll just go online and find a number. And it may not be for the person who I ended up working with to schedule it, but someone can connect you to whoever you need to be connected to. And it pretty much worked out. You just have to find some starting point, and someone will be able to get you to the right person. You just have to reach out, I think.
Great. Thank you. So this one is for Mindy. How do you get community buy-in, especially for screenings?
Um, that's a tough one. I think one of the things that we've learned that we've had to do is to host screenings in events that are health centered. So, a lot of organizations or hospital systems will host health fairs, especially around the back to school time. And so we just kind of jump on that train to provide the hepatitis B portion because they'll usually already have like blood pressure, blood glucose, HIV, HCV testing. So people come prepared for that. Um, and people really turn out for things that are free, especially the immigrant and refugee community, because they have so much trouble getting health care otherwise. We did go to one festival that was just a multicultural festival that just had like games and police departments out there, and we only got two people to be screened there because people were there to have fun and they weren't there prepared to have their blood drawn. So my advice would be um, to host your events within like a health centric event. And also just tap into your community partners to find out when those events are going on and see if you can host a table there.
Great, thank you. The other question is, how are you able to get nursing volunteers at your screening events?
So I think we have the privilege of having a healthcare center that's affiliated with CPAC, so that's one thing. But the other one is there are actually a lot of nursing associations in your city. I mean, I'm not sure if that's true for every city, but I think they do exist if you just kind of poke around. Um, so the one that we use a lot is the Filipino Nursing Association, and I think they're like a national association as well, so they might have chapters in different states. So we tap into them for volunteer nurses, and also a lot of local organizations might have nurses within their membership. So if you just reach out and ask, they might be able to offer up someone's name and connect you to someone who might be able to volunteer. Um, so we get a lot of volunteer nurses through those avenues.
Great, thank you. We did have a question. What is a reasonable start date for the grant? So for the grant, the funds have to be distributed by September 30th. So the grant start period would probably begin at the beginning of October. And then just looking through, we do have one more question for Mindy. How have you been able to overcome the stigma issues that you've seen in the communities that you work in?
The can I just need a clarification on what the stigma is
Sure.
surrounding. Yeah.
Sure. I think with screening and diagnostics.
Yeah. Yeah, we do have a lot of that, and that actually varies between cultures. So our Burmese senior group, they were definitely like very against it when I asked if they would be interested in screening. So I think the first step to that is education. So after we held our education session yesterday and talked about what the risk was, what happens if you develop hepatitis B, and how it doesn't usually show symptoms for a very long time. We took a poll of how many people were interested in being tested, and like a handful of people raised their hand, which is more than zero. So I see that as kind of a win. So I think education is the first piece, just getting them familiarized with, what hepatitis B is and how it could affect them personally. Um, and like I said, that's not across the board applicable for all cultures. Like our Chinese group is like super amped up about getting tested. So really figure out which group you're working with and what their specific beliefs are about being tested and targeting that specifically.
Great. And then another question, what incentives do you give to participants? So I guess, Deb, you mentioned food was really the incentive that you guys use. But Mindy, do you guys use incentives at all?
We do. We have a lot of just random CPAX merchandise that we give. We have pens, we have tote bags, and then once in a while, when we have enough funding, we'll do raffles or gift cards. So we'll do like $5 or $10 gift cards for like the first 10 people who agree to be tested. Or if it's an education session, we say like there are 5 gift cards up for grabs. If you can, answer these questions about Hep B at the end of the session and you answer it correctly, you'll get a gift card. So that kind of incentivizes them to pay attention throughout the session. And then food, always. I agree. I totally agree with that. Food is a big draw.
Awesome. Deb, did you have anything you wanted to add to that?
No, the food. I think that's important. The food. People want to be fed.
Definitely.
And coffee.
I agree. Well, I think that's most of the questions that we received. A couple of questions could be answered by looking at the RFP. So one question that we did receive was about the outcomes and objectives around the mini grant, and so I would guide you to the RFP, which is in your handouts. I can also send out a copy with the PowerPoint and the link to the recording of this session as well. And I wanted to apologize again for the technical difficulties that we had at the beginning of the webinar, but we certainly appreciate your patience and staying with us throughout the presentation. I also wanted to thank the presenters for their rich discussion today and leading us through this webinar. And we have taken notes on questions and comments that we didn't get to, and so we'll be sure to directly address those questions that we didn't get to. Also, as you exit the webinar, please look for a survey from the Hepatitis B Foundation, and we'll be sharing the recording of today's webinar via email. Thank you again, and I hope you enjoy the rest of your day.
Thank you.
Thank you.